Okay, ladies. Well, this next expert is going to be quite a treat. Carrie Levine is the author of The Whole Woman Health, a guide to creating wellness for any age and stage. And for more than 25 years, she has served as an RN, a certified nurse midwife, a functional medicine certified practitioner as well. And she actually evaluates and treats most common women's health concerns, incorporating gynecology and functional medicine. So she has got the goods for us. And today she's going to answer some of our real questions. And I appreciate you being here today, Carrie.
Thanks for having me.
Yeah, Carrie actually works with women to identify and break down their health goals and to create them into attainable steps. So she looks for underlying causes of illness, seeking to find ways to connect the dots in what might seem as unrelated. So that's some of the stuff we're going to talk about today, because many of the things that you might not realize are related to menopause might be. And so I'm excited to hear what Carrie has to share with us. So Carrie, tell us a little bit about this great book you've got going on, Whole Women Health.
Well, so I have been practicing functional medicine since 2006 when I started working at Women to Women, which was a world-renowned women's health clinic in Yarmouth, Maine. And it was there that I was introduced to the functional medicine model, which is really a systems biology approach to treating chronic disease and wellness. And what that means really is looking at how things are related to each other, because we are one. We are whole beings. And as much as conventional medicine might like to slice and dice us, as the saying goes, you've got GI issues, you see the gastroenterologist, you've got autoimmune issues, you see the rheumatologist, you've got hormone issues, you see the endocrinologist. In fact, all of these systems are related in their body and in our bodies. And so that really was something I inherently sort of felt and understood. And when I got to Women and learned functional medicine, I finally was given the language for how to talk about some of this stuff.
That's awesome.
Yeah, it is. And it's really about like getting to the underlying physiology that's causing a problem instead of just prescribing a medication to make the symptom easier to manage. And so this book is essentially an offering of an introduction to this model. So I really wanted to increase women's access to the model and really want women to know there is another way than taking a pill for an ill. Not that that's always a bad thing. Sometimes that's the right thing for the right person in the right circumstances. But as I'm sure is true for many of your community, because they're here, they're looking to understand why and what is within their control to do to help themselves, let alone find a practitioner who can help guide and educate them in a respectful, empowering way. So that was sort of the mission behind the book. It's a walk through the functional medicine matrix, which is a teaching tool used by the Institute for Functional Medicine to make sense of people's symptoms and physiology. And each chapter offers lifestyle recommendations, nutrition recommendations, supplement recommendations that are available and accessible to most of us. And it also walks through conventional laboratory testing and then the kind of testing that you can access through someone practicing functional medicine or something like it, like certain naturopaths or acupuncturists or even chiropractors can access some of this kind of testing. So that's the book in a nutshell.
That's fantastic. And before we forget, Carrie is actually offering one of these as a free giveaway. So everybody who that resonated with, I want you to drop a book in the comments, because anybody who does that is going to go into the free drawing, and somebody is going to get that book. So that's pretty incredible. And then everyone can go on Amazon.com to find it, right?
Yeah, all online major book retailers. Yeah. So bookshop.org, Barnes and Nobles, Goodreads, all of them.
Awesome. And it's Whole Women Health, a guide to creating wellness for any age and stage. So be sure to find that. It's got some great information in there. Now, Carrie, let's dive into a few of the real specific questions women asked. And that way we can tackle those. And then you can share with us, like, what are those things that are symptoms that might not be as common that women don't realize are connected to menopause? So first I want to ask, Deanna asks, how do we control our hormones when they've had a full hysterectomy? If it's different for those who haven't.
Mm. So it's obviously very different. A total hysterectomy or complete hysterectomy means removal of both uterus and the ovaries and the fallopian tubes. So for people who don't know what that means, a partial hysterectomy leaves at least the ovaries and sometimes the tubes as well. And our ovaries are our primary hormone production site in our body. And so if those are surgically removed, that is going to have a profound impact on our physical, emotional, and spiritual health on all the levels.
Right.
I do think it's worth women understanding that there is some sex hormone production that happens in the adrenal glands being small glands that sit on top of our kidneys. And their primary job is to make cortisol, which is our stress hormone, as well as epinephrine and norepinephrine, other stress hormones. But they also are the primary producers of DHEA and testosterone, which happens to be the precursor to estrogen, which not everybody understands. So for all women, testosterone is the precursor to estrogen, and we'll still get some hormone production from our adrenals.
Fantastic.
So if someone is naturally menopausal just by nature of age and passage of time, or surgically menopausal because she's had a complete hysterectomy, she still is going to get some hormone production from the adrenals. And there is, in fact, no off switch to hormone production. So I think it's more complicated in a woman who's had a total hysterectomy because there's nothing coming from the ovaries. There's only what there is from the adrenals, which means if she's had a stressful life and not taken good care of her adrenals, that sex hormone production is going to be minimal because the adrenal function is primarily focused on the stress hormones. So they're really looking at a more, in some ways, more complicated picture, more comprehensive picture on the one hand. On the other hand, some people would say, well, you don't have to take progesterone because the primary mechanism of progesterone is to protect the uterine lining from estrogen, and there is no uterus, so you don't have to do that. There are some people who would say it's the symphony of the hormones and how they all play together. So even if there isn't a uterus, you still want to give progesterone. For me, it really depends on the individual woman and what her specific health concerns are. For
As
example,
it should. Each
right?
woman needs to be treated individually, right?
Eureka, right? What
because for every single thing we learn, we can learn something that argues the same thing, right?
Exactly, right. And
So,
this is the trick with medicine. It is largely art and it is evolving. And so whatever we thought we knew, like we thought Premarin, 0.625 milligrams of synthetic estrogen in 2000 was great for everybody. When the Women's Health Initiative published their study in 2002 and was like, oh, actually, maybe that wasn't awesome for everybody because look, we have increased incidences of stroke and cancer in that. Maybe one size fits all oral synthetic hormone is not ideal.
Right.
So for me, it largely comes down to a conversation and often testing as well, comprehensive testing to make a decision as to how can a woman be supported by hormones to feel her best.
Right. That's awesome. And you know what feels great is to hear that when you're in functional medicine, you're actually listening to patients as opposed to, traditional medicine where they just simply dictate and it's a blanket statement. And that obviously we have found doesn't work because there's too many women out there feeling miserable from what they think is right because they trust a doctor when they go. So thank you for the work that you do because it is important to listen and come up with those varying functional practices so that we can have better results and feel good. And what a relief to know that there is still something in our bodies, even beyond a hysterectomy, that can help you. We just need to take good care and lower stress so that our adrenal glands can function well to help you, right?
That's right. Stress is everything. And we really too quickly blow it off as just like, yeah, well, everybody is stressed.
Right.
What I find myself explaining so frequently to women is stress has a profound effect on our physiology. And
Mhm.
that is real and concrete and researched, at least for now, until proven otherwise.
Mhm.
It will affect our body in a whole variety of ways that in and of itself can look like menopause, right? I mean, brain fog is such a classic
Right.
present symptom, brain
Mhm.
fog. Brain fog can be low estrogen for sure, but
Mhm.
brain fog can actually also be adrenal related. It also can be related to foods that we've eaten that are inflammatory for us.
Right.
So you were sort of talking about what are symptoms that seem like menopause, but maybe
Mhm.
are something else, or seem like something else, but could be menopause.
Right.
Brain fog is one of those things.
Yeah. Well, that's great to know. Now, Cindy asked, what are supplements are best used after menopause? Are there particular ones that they should really look at diving into? I know magnesium is one that we stress in the Flip This Chick program. Can you talk about other supplements that we need to really elevate?
So again, I caution against making any sort of blanket statements. People really need to be treated as individuals, and their individual health history needs to be taken into consideration when
Of
making
course.
recommendations. But
Mhm.
in general, I recommend a multivitamin, fish oil, vitamin D, probiotic. I recommend B complex, specifically B12, because B12 deficiencies have been found to increase the risk for falls in postmenopausal women. And
Mhm.
we all know that as an older woman, falling and breaking a hip can be the fastest track to our demise or loss of independence. So
Right.
that can be leveraged against with a variety of things, B12 being one of them.
Mhm.
And then CoQ10. CoQ10 is a potent antioxidant that has been documented to decline naturally and normally with age,
Mhm.
and has a lot to do with our cognitive function,
Right.
as well as our ability to detoxify living on Earth, which naturally gets harder to do the older we get.
Mhm.
So those are like, I consider those core nutrients. So that's just for someone who's generally well and
Mhm.
looking to maintain their health, depending on whatever specific health concerns they have. I
Mhm.
may recommend magnesium. I may recommend, you know, symptom specific supplements like Siberian rhubarb for hot flashes, or maca for decreased libido or vaginal dryness. There's Vitex and chasteberry, there's Don Quai, there's really no end to the things that can be helpful.
Mhm. That's great. Good to know. So then as we talk about some of those uncommon symptoms, we're we even see that new allergies come up at this stage in our life, or you can
Mm,
have joint pain and think it's arthritis coming because of age. But things like that can actually be connected to menopause. Is that true?
absolutely true. And estrogen for many, many women has a potent anti-inflammatory effect. And
Mm.
so I sometimes think of our bodies as pre-menopause as simmering pots,
Mhm.
and estrogen as like the lid on the pot that's keeping a lid on the simmering on the inflammation. And then menopause happens and we have a decline in estrogen, and all of this inflammation shows up and boils over for many of us for the first time.
Right.
And it can stop you in your tracks for sure. And I'm probably speaking to the choir, but you can wake up with joint pain and be like, is that Lyme disease or is that menopause? What the heck is that?
Right.
So it really can be profound. And so for some women, it is a potent anti-inflammatory. For other women, estrogen can actually be pro-inflammatory. And I would say
Mm.
that is a much smaller percentage of women who come in with sort of the laundry list of concerns, and we talk through it and they choose hormone therapy. And I'm like, oh, this is really going to help them. And they
Mhm.
take the hormones and they, in fact, feel worse. So that does happen. I would say it happens much less frequently than women having some of those inflammatory symptoms improved by
Mhm.
hormones.
I think the whole moral of the story is that everyone needs to realize when you get information and start doing one thing, you need to stay in control of your own health and react and say, okay, well, this is how I'm feeling after that. I need to try something different because that doesn't feel good. And keep trying until what you are doing feels right. Right. And you are vibrant and healthy and mobile and all of that. I
Mm.
think, it sounds like the most important thing. Ask questions, give feedback, and make changes as you need to do that.
Mm. Well, I think you're speaking to something so important, which is that we stay embodied through this experience and
Mm.
we give whatever our experience is its full due, regardless of what the doctor says it should be, or regardless of what our girlfriends say it should be, or whatever the marketing pitch on the supplement sales on Instagram said it would be, is to just
Mhm.
stay connected to our bodies, to be honest with ourselves about what is our lived experience to this intervention in our body. And what I say to women is try it, try it for 6 weeks, try it for 12 weeks.
Right.
At the end of the 12 weeks, ask yourself, same, better, worse. Like,
Mhm.
where are you? Good enough, not good enough.
Right.
And
Any
that's like
change.
the way I engage with people about it. Like, I'm not necessarily looking to help people obliterate symptoms, right? Our bodies talk, our machines age, there's validity to all of that.
Mhm.
It might be unrealistic to think, some people would argue this. Some people think it would be unrealistic to think that our sex drive or our hormones or our energy is going to be the same as it was when we were 30. Some people aim to achieve that. Some people think that's unachievable. We have to define for ourselves, what is it
That's
that
right.
we're after
Mhm.
and what is helping us get there. And definitely do not be handed a prescription and wished good wishes for the year and say
Mhm.
goodbye and good luck. I mean, for me, there is so much art, and this is the art of medicine in supporting women, particularly around hormones, where I don't actually really know what something is going to do when I drop it into somebody's bloodstream.
Mhm.
I have years of clinical experience to refer back to. I have clinical studies that I can refer to, and still someone is going to have her own experience that is valid and worthy of responsiveness to. So I echo your sentiment, which is don't give up. Don't shut up and don't give up and don't walk away. Keep sort of pressing on and pursuing until you can find someone who's willing to listen and have the conversation and do the follow-up and be accessible to help troubleshoot what's happening and how you're feeling and what's better and what's not better. It is not a linear process.
Oh, that is great. One last question before we let you go. My own family has a history of breast cancer as well as ovarian cancer and things like that. So, can you share with us if there is a difference in the quick response to get hormone replacement therapy if you have a family history of cancer or issues like that? Should you have more concern? And, are there lots of great natural things we can do if we shouldn't go that path at all?
Mm. So I would say that one of the most important pieces of information in terms of assessing family history and an individual woman's risk is, did that family member get cancer before the age of 50 or after the age of 50? Because if it happened after the age of 50, more often than not, there's not a genetic link to it. So if a woman says, my mom got breast cancer, and I say, how old was she? And she says she was 72. I'm like, yeah, so she lived a long life. And at some point, the duplication in her genes went haywire,
Mhm.
which happens the longer that we're here. And I don't know that she is necessarily in and of herself at increased risk for developing an estrogen-dependent cancer. That being said, part of my conversation is when we just have a low threshold. If you
Mhm.
feel a breast mass, we're not going to sit around and wait
Right.
and monitor. We're going to get you in, have an exam, be evaluated, possibly have a biopsy. Like, we want to hold that history in our consciousness and knowing and moving forward.
Mhm.
But is it in and of itself reason to not take hormones? Not necessarily. There are nuances there. And I would say that in that situation, the piece of information that I find most helpful in guiding that decision making is looking at the way women are detoxifying their hormones, which can be, that information can be obtained through urinary tests, through functional labs. Genova Diagnostics has one, Precision Analytics has one, and we can look at the way the body is detoxifying estrogen. And those estrogen metabolites are being studied quite heavily at conventional medical institutions like Johns Hopkins, and being associated with either disease risk and prevention or contributing risk to disease. And so I want to see, are you making a lot of 4-hydroxyestrogen? If you are, can we modulate that through aerobic exercise, ground flaxseed, and high-dose fish oil, or supplementation of broccoli seed? Or do we do all of that and you're still making high levels of 4, which is associated with an increased risk of cancer, which means maybe we want to exhaust other resources first.
Right.
I'm generally an advocate of exhausting other resources first, unless a woman has got her heart set, because there's a lot of resources.
Right. Absolutely. And the combination of that.
Yeah.
And what I love about your Whole Women Health, that guide to creating wellness for any age and stage, you're actually giving us resources and ideas and suggestions for where to look and what to think of and what to try. So
For sure.
we can begin not only holistic, but, a positive and healthy approach to being in control of our own health. And it's critical. We always should feel empowered to be our own advocate. We raise our children being their advocate, and this is a time in our lives where we need to be our own. And I appreciate the work you do so that you can help us do that.
Oh, thank you so much, Alicia. Thanks for bringing me on and sharing another way with the women who know there's another way.
Yeah, absolutely.
Yeah.
Thank you so much. We'll look forward to finding out who gets to take home that book. So don't forget, ladies, drop book in the comments and we will do a drawing for that. And then check out Amazon. And actually, I got the lowdown that Carrie is going to shoot for getting that book on Audible this fall. So we can look forward to maybe catching that in the book club, which will be great. So I appreciate all your effort and look forward to keep an eye out for you, Carrie Levine. They can find you on Instagram. How do we do that? What's your
Carrie Levine CNM, both Instagram and Facebook.
Fantastic. We'll be following you because so much, a wealth of knowledge and information, and we appreciate it. Thanks.
Thank you so much. Have a good rest of the day.
Yeah, thank you, Carrie.
Bye-bye.